in a place where he works.
And then if somebody wants to sit on the floor, I can sit.
Alright, everybody knows there's a phone, there's a link, because it's going to get microscopic. So, are we ready?
No, we don't know.
I will look over your shoulder if need be.
Okay, gotcha.
Well, I'm just watching.
Make it bigger here.
If you have an iPhone, I can.
Part doesn't matter.
Left my stupid phone over there.
In the shadow.
How do I do that?
Do you guys have iPhones?
There's a QR code you can scan.
Just get on Facebook real quick.
Yeah, I got it. I
Well, I can't. I mean,
Can you see if the link? Can you see if the link works?
Well, I'm recording it, so
like,
I sent the link to the
sorry.
Twitch onto Discord. Does it work?
Oh wait.
Sorry.
Hotspot me for a second.
Oh God, what?
Is it Twitch?
Sorry.
Oh God.
It's on Discord.
Okay. 1 second. Sorry. 1 second.
Okay.
We're on Discord. Oh, in
The SilkenFest.
Okay. Gotcha. Okay.
I posted a link.
Ignore it.
Oh, it didn't.
oh, excuse me.
No, why is it not a hyperlink?
Okay, so some of this may get a little bit advanced. Maybe I tried to make it as simple as possible, but I know that holters are being done. Kind of Joyce asked
Can you
me
post it to a
talk
Facebook
about
too, for sure?
holters, but I felt like
Just a link.
before we could get there, because
We're on Facebook.
electrophysiology
The SilkenFest where they're asking.
Electrophysiology is so complicated. I wanted to make sure that everyone really understood, like, hearts, how they worked, and the kind of diseases that we're testing for with all the different testing modalities. And, you know, Silken's just joined OFA, so we don't have statistics for them. Like, or I don't anyway, I didn't know the statistics. So I've kind of extrapolated the most common cardiac diseases in dogs, the most common cardiac diseases in borzoi, whippets, and some shelties too, and so that's what I'm going to touch base on. Alright. So, like, when I think about a heart, or I try to describe a heart, I think of it in two parts. And part of a heart is the structure, right? So, it's a muscle, it has chambers, it has valves, it has vessels coming off of it, and things can go wrong with all of those parts, but there's also an electrical system too, which consists of nodes, we think of a pacemaker, and nerves going down to innervate the chambers and regulate the heartbeat. So it's really a two-part system, and things can go wrong in just the structural or just the electrical or both, and a lot of diseases cause changes in both. It can be a primary structural disease that causes electrical problems too, or a primary electrical disease that causes structural problems too. So it can get really complicated when we're testing for it, because sometimes we don't know what comes first, the chicken or the egg, right? What are we looking for? So in a normal heart, you get unoxygenated blood first, right? It's coming through like a jugular vein, down into the vena cava, and blood goes into the right atrium, and then it flows through the tricuspid valve into the right ventricle. And so, during this stage, when the blood is filling, that's diastole, that's the bottom number on your blood pressure, your heart contracts and it pushes blood through the pulmonary valve, through the pulmonary artery. So this is unoxygenated blood, and in the heart is the only place in your body where you're going to have unoxygenated blood going through an artery, and oxygenated blood coming through a vein, so that can be a little bit confusing. And then your blood gets oxygenated in the lungs, it comes back through the pulmonary veins, into the left atrium, through the mitral valve, which is a really important valve that you'll need to pay attention to, into the left ventricle, which is the strongest chamber in the heart, because when that left ventricle contracts, it goes through the aortic valve into the aorta, and that blood has to get to your entire body. So, I mean, that's a really tough thing to think of, this one little organ pushing blood, circulating it through the entire body. It has to be really, really strong. And so when something goes wrong, it kind of becomes catastrophic. Alright, so the other part that makes all this happen is the electrical system. And the SA node, or the sinoatrial node, is the pacemaker of the heart. So it's what sets the heart rate for the atrium, the top chambers of the heart. And when you think of that, like in dogs, it's a really big variation, small breed, big breed, but about 60 to 100 beats per minute when they're relaxed. Once those atrium fill, then the heartbeat goes down to the AV node, or the atrioventricular node, and it slows the heart rate down, because to fill the ventricles takes longer than it takes to fill the atrium. And so that heart rate is about 40 to 60 beats per minute. And then there's little nerves that go down to the bottom chambers of the heart that cause them to pump and push blood, to the lungs or to the body. And that's an even slower rate, so, less than 40 beats per minute. Does anybody have questions about the normal stuff?
Oh, sorry.
Yes?
Yeah.
Anything? I know it's complicated, but are we okay so far?
Yep.
Alright. Alright. So before I talk about heart diseases, I kind of hear people using terminology a little bit wrong. They'll say, my dog has a congenital disease or whatever. So I just wanted to clear up terminology. So when we say hereditary or inherited, we're talking about a disease that you pass on to your offspring. Now, I will say that you yourself can have a novel mutation. You can get a mutation yourself. You're the first person that has it. And that mutation can become hereditary. So an example of this that we should know about in people is achondrodysplasia, right? Dwarfism. Most people with achondrodysplasia, the mutation is just in them. If they have children, there's a 50% chance that their children will inherit that. So the mutation happens with them, they pass it on. Now this is something that we know we see in purebred dogs because all different breeds have their own diseases, right? So when we close that gene pool, if a mutation happens in there, then we start seeing unique diseases happen in breeds that probably occurred in that breed or the founder dogs. So it's really important to start screening dogs before there's a problem and have a baseline of information, because some of these mutations, especially recessive ones that are hereditary, we don't start seeing until they start meeting each other again, right? So they pop up in the breed, and then several generations later, they meet a dog that also has it, you line breed on it, and then you get something established in your breed. So it's important to have the data to be able to track it back and say, okay, where did this come from? How bad is it? A congenital disease is a disease that you have from birth. So you're born with it. It can get worse, but it's there. In fetal development, the change happens. An acquired disease is something that you have a perfectly normal heart at birth, and then as you get older, at some point in your life, things start to change. A disease can be hereditary, so it's inherited, and congenital, you're born with it, or it can be hereditary and acquired, or it can be congenital and it's not a mutation, so you were exposed to a toxic plant or, something in utero and you're born with it, or it can be acquired and not hereditary, like you got a certain drug and it put you into heart failure or whatever. Alright, so the congenital cardiac diseases, all of these, they're suspect that they are hereditary. Now, not always. We know some cases of these diseases in people seem to be spontaneous. They don't know where they came from. But all of these diseases have increased incidence in certain breeds. And so when you see an incidence of a disease in one breed that's higher than in the general dog population, you have to think, all right, they're passing this between themselves, right? There's something going on. So the first one is patent ductus arteriosus, or PDA. Have any of you heard, do we have PDAs in Silkins?
Not
No?
really.
Never heard of them?
No, we've heard.
Oh, you heard of them?
Because I'm a nerd. Only because I'm
Yeah.
a nerd.
So this is actually the most common congenital disease in dogs. Basically, there is when the fetus is an embryo, there's a little vessel that goes between the aorta and the pulmonary artery, and it allows blood to bypass the lungs because you're not breathing. You don't need them. It's a waste of energy. And when the puppy is born, the change in pressure from taking that first breath and getting the fluid out should cause that vessel to close. When it does not close, then we call it patent. You know, it means open. And it becomes an issue because you are needlessly recirculating oxygenated blood, and it puts a lot of pressure on those heart chambers. And if it's big enough, the dog will go into congestive heart failure. So I was just telling Joyce, I'm just showing Joyce pictures of a Borzoi that had surgery to close the PDA today. It happens in Borzoi. This is a foster puppy that I had, Journey, who had a PDA that was closed, and she's wonderful now. She just turned 5. So
We've gotten it. It's just not common.
not common. I don't hear of a ton of it in Borzoi, but it's definitely there. All right, it's again most common defect in dogs. It's there. It could pop up anywhere. You know, it's probably something that happened in dogs generations and generations ago before breeds, right?
I'll get my puppy.
When you take your puppies into the vet for their first puppy visit, you hear a washing machine murmur, so it's kind of a continuous murmur. It's whoosh, 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 whoosh. And the treatment is surgical correction, so this is a good one to have because you can fix it. All right, a lot of them you can't fix. It is overrepresented in Shelties, so you see it a lot. So thought it, maybe a little bit more important for Silkens because there is.
It's the foundation.
It's a foundation, yeah. So the next one is a ventricular septal defect, or a VSD, and so this wall between the ventricles is called the intraventricular septum, and for some reason during development it doesn't close completely. So you get a hole between the ventricles, and so that means that unoxygenated blood and oxygenated blood are going back and forth between the ventricles. The severity of the disease depends on the size of the hole. So obviously a little teeny tiny hole, fine. A big hole, it's a problem. They go into congestive heart failure. Again, when you take your puppy to the vet, it's a continuous murmur, and the loudness of the murmur doesn't necessarily correlate with the severity of the disease. In fact, the louder murmurs tend to be better, okay? So if you take your puppy in and they say that they suspect a VSD, and it's a really loud murmur, don't panic. This is Bella, my mom's 17-year-old wind sprite, and she has a VSD, and she was echoed 6 months ago, and she has a perfect heart. Wow. All right? So it's not always a death sentence. So if you breed a puppy that has one, don't panic. Some of these dogs can live perfectly normal lives. But again, it is overrepresented in bulldogs, schnauzers, and West Highland White Terriers, so you may not want to breed that affected dog. Okay? Alright, so stenosis. Stenosis means narrowing. And the most common areas of narrowing in the dog are at the aortic and pulmonic valves. Subaortic means that it's like right outside the valve, not the valve itself. Subaortic stenosis, we call it SAS, and it is usually seen in large breed dogs, so Rottweilers are kind of like the poster child for it. These dogs can have a murmur, but they don't always. It is a little ring that's between the ventricle and the aortic valve, so it kind of is a little muscular ring, and basically there's a change in pressure gradient, so it's really hard for the blood to come through. This is the leading cause of sudden death in dogs in general. So I know, ooh, but Borzoi aren't common, okay? So when we look at dogs as a whole, this makes young dogs drop dead more than anything else. And oftentimes, you know, they're 7 to 15 months old and they're gone. Sometimes there are clinical signs of just fainting, but not always. I have seen one case of aortic stenosis in a Borzoi. Pulmonic stenosis, so go the other valve, the valve itself is stenotic, is uncommon in large breed dogs besides bulldogs and boxers. Again, it's narrowed. They can have a murmur. Treatment for both of these is just aimed at managing congestive heart failure and associated arrhythmia, so there's no really good treatment. They need an echo for diagnosis. So, you know, if you hear a murmur, there are some distinctions, but since they don't always have a murmur, this is one that you need to have your dog echo before breeding, because they could have it and not have a murmur. So I said it's uncommon in large breed dog. This is Junie, a Borzoi, and she has pulmonic stenosis. So it can happen in Borzoi too. Alright, so these next couple are going to be a little bit confusing because mitral valve degeneration sometimes, you know, sounds like dysplasia. So atrioventricular valve dysplasia is something that they're born with. So it can happen in the mitral or tricuspid valve, and they're born with their valves deformed. The more common is tricuspid valve dysplasia, and both of these have been diagnosed in Borzoi. So they both have congenital, their valves are deformed, they start to leak, they can develop congestive heart failure. Labrador retrievers are kind of the poster child for tricuspid valve dysplasia, and through their lifetime studies, they found, like, you know, they're like, oh, these dogs it's not that bad, they're fine, we're going to breed them, and then as they bred on, the dogs started dying from it, right? So minimally affected dogs can produce severely effective offspring, so if you have one, it's definitely something to pay attention to, because even if they're mildly affected, it doesn't mean that it's not going to get worse. Murmurs are not always present, but they can be. Just, you know, if the valve is just barely thickened, they may not have a murmur. You need an echo to diagnose because you have degenerative valve disease too, right, which is different. And again, in people, they do valve replacements. Do that in dogs. So management for severe cases is just managing congestive heart failure. Alright, the acquired cardiac diseases. The ones that you aren't born with, you can be born with the genes for them, but they develop later in life. I don't like this word. The most common is chronic myxomatous valvular degeneration, also known as endocardiosis. You guys will know it as MMVD, so affecting the mitral valve. And mitral valve disease is the most common acquired cardiac disease in dogs, and probably the most common cardiac disease in dogs, period. It's really common in Whippets. Cavalier King Charles Spaniels, I think 96% of them will develop mitral valve disease, so you can get it stuck in a gene pool and it's a problem. Silkens have it. I've seen it. I've seen, you know, multiple echoes with it. Basically what happens is as they age, the valves break down, they start to pull apart, they're replaced by fiber, and as they can't close, you know, you start to get blood flowing back and in the wrong places, and you get heart enlargement. It causes, with the mitral valve, left-sided congestive heart failure, so that left atrium gets big. Diagnosis is by echocardiogram. This is Ashley's dog who I bred Fig. He's got it. I will say this. In Whippets, they go into congestive heart failure. In Borzoi, in the retrospective 20-year Borzoi study, only one dog actually developed congestive heart failure. So the progression of the disease tends to vary with breed. I don't know what you guys are going to get. I don't. And I think in Borzoi, most of them were females, where in other breeds, most of them are males. So, Alright, dilated cardiomyopathy. This one I hate. This is Nora. It's Olive's sister. And she is 9 months old, and we're going to see a lot of Nora, unfortunately. Dilated cardiomyopathy can be a phenotypic description, which means that it's not always a genetic disease. And when we say DCM, we just mean that that's systolic function. So those bottom chambers of the heart are not pumping blood through normally. But it can be caused by many things. So I know when we think of DCM, we think of like Dobermans, right? It's hereditary in them, the end, but DCM can have several causes. Basically, as the heart is not able to pump normally, it's a muscle. You'll use it or lose it. So if it can't pump, what happens? The walls become thin, it starts to dilate out, and then, you know, you can get arrhythmias because the pumping is not normal, and in some of them, the heart muscle gets replaced by fiber or fat. It is usually hereditary, like, you know, in certain breeds, but it can definitely have non-hereditary causes. Clinical signs, fainting, heart failure, sudden death, kind of depends on the breed, how it's going to present. And different breeds manifest early signs in different ways. So in Dobermans, they start screening at like 3 to 4 years old, and they start doing Holters, and they're looking for ventricular arrhythmias. In Irish Wolfhounds, they start doing ECGs. They do a 3 to 5 minute ECGs, and they get AFib, which is totally different. They don't get ventricular arrhythmias. So heart starts to look the same at the end of the game, but a different, obviously, inheritance and disease process. Boxers, they have ARVC, arrhythmogenic right ventricular cardiomyopathy, and their Holters also show abnormal ventricular beats, but the progression is a little bit different. So in Borzoi, I know we've heard about DCM, but it's not the same as Boxers or Doberman or Irish Wolfhounds, and so they don't have like a classic pattern of who's going to do it and who's going to not do it. And I will tell you, on necropsy, their hearts look perfectly normal. So that could be a problem in Silkens, and very frustrating, and I can't answer for you yet what exactly is going on, but hopefully I will be able to tell you soon. So just depending on the breed, annual, Holter, ECG, and echo screening is warranted. So for you guys, you know, if we're trying to rule out if they're developing DCM or these arrhythmias that can lead to DCM, I think that you're going to have to do both until we know if it's here or not. So, these are both Borzoi hearts. This is my 10-year-old, and basically, you may have to look on your phone. Head is going to be this way, and tail is going to be this way. This is the spinal column. In a normal dog, the trachea kind of goes downwards. The heart sits nicely. It's not too big. In this dog with dilated cardiomyopathy, you can see that like the trachea is pushed up, almost touching the spine, and that's because his left and right atria are super enlarged, and then this part looks fatter, and that's because both of his ventricles are large. So all 4 chamber enlargement in this dog. Okay, do y'all know how to read an OFA form? Those little initials, do you know what they mean?
Nope.
Tell us. No.
I sleep dumb.
So, because my luck is wonderful, this is Fig's brother, and he has DCM. So this is his OFA form, and when you look at the form, you know, RV is the right ventricle, and it says, you know, normal, mild, moderate, severe, and that's talking about how dilated it is. RA, right atrium, same thing. LV, left ventricle. SF is the shortening fraction, so that is measuring how well the ventricle is pumping in. And then EF is ejection fraction, and that is a measurement of how forceful the blood is leaving. So you want the SF to be be greater than 20%. What's his? It's awful. Yeah, 10. You want the ejection fraction to be greater than 40%, and that's like literally, I don't like that. My healthy borzoi are normally 55 to 60%. And his is 19. Yeah, really good. So the interesting thing about this dog, TV is tricuspid valve, TR tricuspid regurgitation. So is the valve abnormal, deformed, and then is blood, how much blood is leaking back and forth, and then MV mitral valve, MR mitral valve regurgitation. So this dog has both changes to his tricuspid and mitral valve, as does his brother. So this dog could maybe not be a true DCM, but has such severe valve disease in both valves that he looks like he's just in all chamber failure because all his valves have failed. Don't know, but it's possible, and that can happen too. And that's why I say DCM is a phenotypic expression, because many things can go wrong to make your heart get big and your walls get thin. All right. Other acquired cardiac diseases. HCM is hypertrophic cardiomyopathy. It's kind of the opposite of DCM. The ventricles get really thick, like the muscle is super, super thick. I've seen it diagnosed in one borzoi. Now, the problem with HCM in our really athletic dogs, and in athletic people too, is that their muscles, they run. Their heart gets thick when they run and exercise. So this is kind of a diagnosis that is hard to say when we have a sudden death dog that's a super athlete. Do they just have a really muscular heart, or did they have a problem? It's pretty rare in dogs overall. It is the leading cause of sudden death in cats and human athletes. And it is definitely genetic. So I don't know if any of you breed cats, but Maine Coons, Sphinx, Cornish Rex, they all have to screen for HCM. It's a big problem in them. Next is neoplasia, so cancer. Silkens have hemangiosarcoma. You see it?
Not in hereditary way. We're working with Jeff Bryan at University of Missouri. He's the oncology professor there. He's been tissue sampling for the people who could bear to send tissue. And we get cancer. We don't have genetic cancer. Like he's been typing them for like the last 10 years.
Okay.
Because he has silkens.
Okay. So hemangiosarcoma,
that's Labrador Golden Retriever.
Yeah. We tend to think of it on the liver or spleen, but actually another common spot is the heart. So it's not inside the heart. It sits, this is the little tumor right here, so it actually sits on a little auricle, which is the flap off of the right atrium. And what happens in these dogs, and we have had one euthanized, 2 sudden death hearts that had hemangiosarcoma in borzoi, is the heart sits in a sac, the pericardium, and so when that tumor starts to bleed, blood just fills up, and so the heart can contract in, but it can't expand out, and so basically it can't contract, and they go into something called cardiac tamponade, and they just kind of get wobbly and pass out and die because their heart can't beat anymore. There are infectious diseases, so you can get endocarditis, which itis means inflammation, different than the endocardiosis, which we were talking about, with valve disease. It can be bacterial, it can be viral, so you can get like a viral myocarditis from parvo, like parvo puppies, or COVID-19. It's a big thing now. Or any kind of like systemic infection, those bacteria can go and stick to the valves of your heart. Chagas disease, I don't think the bugs are out here, but if you live in the Southwest, I had a positive bug at my house because everything goes wrong at my house. It is a parasite called trypanosoma, and it is transmitted by kissing bugs.
Yeah, they're not in California.
They're not yet.
Yeah. Southern California will get it first.
Down south.
Yeah, Southern California. They're not up here.
So basically this bug bites the dog, poops in the wound. It's disgusting. So it's not actually transmitted by the bite. if you do live a place where they're endemic, do not squish them because it's by the poop, and when you squish them, you squish the poop out of them, and you just have to get the poop in you, and people go into heart failure from it too, and it will kill you. Yeah.
How big are those?
I can tell you because I had one on my bed. They're about that.
So those are almost like.
Those are just the different life stages.
Where are you at?
Texas.
Oh, well, Texas has all of them.
Yeah. I did test all my dogs for it, so my dogs are not having problems because of it.
But those can show up anywhere because they're bugs.
Yeah.
Yeah.
They're kind of slow. They can fly, so with these bugs, they're nocturnal. Yeah, you should have seen.
beetle.
I screamed and then I sprayed my whole house with bleach and I just had a nervous breakdown when this happened. Seriously.
Why were you in that bug's house?
Well, they're nocturnal. And so what happens if you turn on? They like light.
Oh no.
So they come to your porch light and they like carbon dioxide. So if your dogs live outside in a kennel environment, they're really high risk because they come to your dog's breath. And then they bite them while they're sleeping.
No camping in Texas.
Yeah.
No Texas.
Yeah, easier solution.
And then probably the most common infectious disease, which I never saw when I was practicing in California, but diagnosed 10 cases a week in Texas, is heartworm disease. So it just kind of depends on where you live. It's transmitted by the bite of a mosquito. They put these little baby worms in the dog's blood, and then they circulate and grow into the heart, through the vena cava and into the right atrium, and basically go down and prevent valves from closing and cause congestive heart failure that way.
Everybody's on preventative, but it is very, very good. It's mostly from imported dogs.
Yeah.
I'm in Arizona and I do preventative, but it's really, really rare. I only do preventative.
You don't
because I
have
travel.
water.
Water for mosquitoes.
In Wyoming, we don't really have heartworm disease. He's just on it because we travel.
Yeah. And that's really important. So it only takes one bite. So if you're going to shows, it only takes one bite from an infected mosquito. Okay? Wow. And your dog won't test heartworm positive unless it has female worms. So female worms carry the antigen. So you can actually have an all-male worm infection that can cause heart failure. And you won't know because they'll test heartworm negative.
Oh, God. That I didn't know.
Yeah. So, and there's a mosquito right there.
Oh, yeah,
They're all over the place. Well, I have bug spray that I was
That
offering
wasn't part of your
Yeah,
presentation.
that's what a mosquito looks like, in case you didn't know.
So if anybody wants any right now.
Way to stage the mosquito. My health.
Alright, so these you may have to look on your phone because there's going to be coming up some halters. So now we're going to talk about the electrical diseases, and this is where it gets really complicated.
Here.
An arrhythmia is basically an abnormality in the rhythm or the rate of your heart, right? It can be classified on its origin. So where does it come from? Does it come from above the ventricles? Does it come from the ventricles themselves? Does it come from one of the nodes, the SA node, the AV node? The rate, so are they tachycardic, going too fast? Are they bradycardic, going too slow? And the rhythm, is it a regular arrhythmia? Is it irregular? Is it regularly irregular? So all of those things can be used to classify them. So many things can cause arrhythmias. So like we said, it can be secondary to structural cardiac disease like dilated cardiomyopathy. I mean, occasionally you can get some arrhythmias from even advanced mitral valve disease, things like that. You can have a primary conduction abnormality. So this is what we think is happening in Borzoi. Okay? They call them channelopathies. And basically, I don't know if you remember, going back to biology, you have your ion channels that allow calcium and sodium and potassium to pass through, and when there is an abnormality in that channel and those ions can't pass through normally, you get a channelopathy. They can occur in any cell of the body because you have those ion gradients in any cell. In the heart, they're called cardiac channelopathies. We know about channelopathies, right? Cystic fibrosis is a channelopathy that causes the thickening of mucus in the lungs. There are known channelopathies that have been documented in dogs. German Shepherds have an ventricular arrhythmia, or an inherited ventricular arrhythmia. Rhodesian Ridgebacks have an inherited ventricular arrhythmia. English Springer Spaniels have something called long QT syndrome, and Schnauzers have something called sick sinus syndrome. So they're in dogs. They can be really hard to identify because you have a normal heart on necropsy, right? So these are identified through genetic testing, and they can be super, super tough. But I say that we think it's in Borzoi because our hearts look perfectly normal, right? So if you have a dog that's died and it has a normal heart, then you're left with, all right, well, this dog died of an arrhythmia. You can get arrhythmias from systemic illness, so fevers can cause arrhythmias. Advanced thyroid disease can cause arrhythmias. So if you have a dog, I always say if you have a dog that has arrhythmia, you may want to check its thyroid before you get super upset. And drugs can cause arrhythmia, so please don't let your dog do cocaine.
You're no
Alcohol, like these things all cause arrhythmias in people.
No drugs or alcohol for the dogs.
This is a normal heartbeat. So you start with a P wave. That's your atria going. You have a QRS complex, and then a T wave at the end. And they measure everything, your RR interval, so between these 2 points, your QT interval, like is that elongated? This right here is, you do not ever want to see this on your Holter. You do not ever want to see this on your Holter. These are like normal heartbeat. Then you have something called R-on-T phenomenon, where that VPC comes early, and when you start seeing squiggly lines like this, it's a problem. So this dog has a line of ventricular tachycardia that's coming very, very fast. Then he has a normal heartbeat, and then a VPC, and then a normal heartbeat. This dog was put on Sotolol. He did not have any changes to his heart for a couple years, but now he does. He has been diagnosed with dilated cardiomyopathy. Borzoi. This is the best Borzoi in the world. All right, so we're going to talk about testing now, and there are different tests that you can do, and they're all important. All right. And they all tell you different things. So one is not a substitute for another. Auscultation. So that's listening to the heart with the stethoscope, right? It's most commonly used to detect murmurs, but if a dog has a really bad arrhythmia, like if, when I'm at the clinic and I start hearing like, or things like that, then, it's a problem. Those dogs usually have advanced heart disease. But arrhythmias don't happen all the time, so you can't count on that at all. Not all cardiac disease presents with a murmur, and not all murmurs indicate disease. So I think this is the most important thing for Silken people to know. 91% of whippets evaluated in their lifetime study presented with heart murmurs, and after echocardiogram, 64% were diagnosed as benign or athletic murmurs. So human athletes, I don't know, it's a huge number of them, have normal tricuspid valve regurgitation. 64% of these whippets had normal mitral or tricuspid valve regurgitation, and 50% of Borzoi in the retrospective study, and even more in the study that's yet to come out, have had normal hearts with mitral or tricuspid valve regurgitation. And actually his father was on the table when I asked to do the Borzoi study, because one year he had mitral regurgitation, the next year he had tricuspid valve regurgitation, and the mitral regurgitation had gone away, and I said, and they called it normal, but I knew people in other parts of the country were having their dogs failed for this regurg, and I said, look, we got to know if it's a thing or not. We need to have some standard for cardiologists to go by, because it's not fair my dog's getting passed and someone else's dog is getting failed. So probably going to be the same thing in Silkens, I would guess, that you're going to have some regurgitation that's totally normal. Now, that said, if you have a murmur, you need to do an echo, because there's no way to know. the difference, right? I recommend it for all puppies prior to going to their new homes, because that's how we do here those PDAs, those VSDs, and other things like that. So it's really important then. And it's part of a complete cardiac screening, because you're going to want to know if that murmur is getting worse throughout that dog's lifetime. When you're going to the vet, you know, your regular vet, it was a grade 1 murmur, now it's a grade 3 murmur. Okay, something is progressing, right? It's not staying the same.
It's chewing on her.
Alright, echocardiogram is an ultrasound of the heart. So this looks for structural changes to the heart muscle, valves, pumping. So looking at how thick or thin that muscle is, are there changes to the valve, is the heart pumping blood through each chamber normally? It is the gold standard for diagnosing cardiac disease in dogs. So the majority of breeds, this is what they go to have an ACA, an advanced cardiac exam now. You have to have an echo by a cardiologist. They won't just listen to your dog anymore, which I 100% agree with. If you've heard of my Facebook post. I personally recommend an echo 6 months prior to breeding, and continued screening throughout the dog's lifetime. Because, like we talked about with these acquired diseases, what is normal on a 3-year-old dog or a 4-year-old dog that you're about to breed, they can develop a problem at 7 or 8. And you don't have to pull all of its offspring out of the breeding pool, okay? But you need to know what they have so that you can breed smart from the following generations. And this is little Nora's echo, and this is, she has DCM, and so this is blood kind of flowing through. So this is like looking at the ventricle, how it's contracting down. And then this is the side, like the left atrium, or it's a left atrium, the mitral valve, and then the left ventricle there, and a little bit of blood is kind of coming back through. All right. An ECG, electrocardiogram, that records the electrical signals of the heart. Every time I put a dog under anesthesia, I'm recording an ECG. I'm watching. Because like I said, some drugs can induce arrhymnias, and I want to know, so it's a really common thing for your regular vet to have. If you do it at a cardiologist, they usually do a 3 to 5 minute reading. And the thing with ECGs is that arrhythmias are not always present, okay? Some of these diseases that cause arrhythmias only happen during sleep. They only happen during exercise. And if your dog is hooked up to an ECG in an office, it ain't sleeping and it's not exercising. And so unless it's really advanced heart disease where you're having a lot of arrhythmias at one time, or if your dog's super nervous and you just happen to get lucky, you may miss it. Okay? It is the initial screening of choice for some breeds with DCM, like Irish Wolfhounds and Scottish Deerhounds. But I would say that it's probably, I don't know, I can't say that yet, because we may use it in Forceway. But, you know, I still at this point would probably recommend a Holter over an ECG. Alright, so, Holter monitoring. I guess that's really what we're here to talk about today. It is a small device that basically records a 24 to 48 hour ECG. Most of you are going to be doing 28 hours. If your dog has an echo or something and they pick up arrhythmia on the echo, because an echo records an ECG, then you may want to do a longer Holter. You may want to do a 48-hour Holter just to make sure that you catch something if it's there. In people, they do them for 2 weeks. Our dogs would never tolerate that, but that's just goes to show you how intermittent these arrhythmias can be, right?
It's a good way to get a lot of chewed up vests.
Yes. I allow my dog to perform totally normal activities besides like running in a group, but you know, I let my dogs run my acreage every night. I still let them out and let them run, okay? I want them to exercise. You don't just lock them up in a crate and ask them to hold still. Let them be a little bit of a jog within reason. They're a more sensitive tool than an ECG because they record for longer periods of time. And like I said, arrhythmias are intermittent and depending on the disease, occur when they want to. Alright, Holter results. So this is, I'm say subjectively normal because like I said, a normal Holter one day, don't feel so good about it, right? It's great that it's normal, but that doesn't mean that there's not a problem because they can have an arrhythmia tomorrow. So the real thing with Holters is if you get a bad result, believe it, right? If you get a good result, that's great. Test again next year. This is kind of what your Holter, your first page of your Holter looks like. So this is probably what most of you are going to be looking at. It just tells you who cares about the heart rate unless it's super fast, right? They go really low. Some of these dogs, so don't freak out. This is a younger board, so she was 7 months, so her heart rate was a little higher, but a lot of them go down into the 20s, and that's okay. Yeah, it's normal. A lot of them do. If they have like a super high number, like greater than 10% tachycardia beats, you may want to be like, why is their heart beating so fast? But you can see some variation in that just depending on how active the dog was. Ventricular ectopy, those are your VPCs. They're always going to list it out looking like this. And then supraventricular, they're not going to have them listed out. They'll just say, if they're present, they'll tell you what they are, and they'll have this list. If they're not present, they're just going to tell you that. And then they may give you some comments at the bottom, and it's really important to pay attention to the comments, because sometimes they'll throw something in, like, your dog is an AFib. And if you didn't look at the comments, you would have no idea. Let's see. Alright, so this is like a second page of a normal Holter, where if you had any VPCs, they would list them out, and then it will give you 30-something pages of readouts of just all of the beats, and then the little squiggly beats all together at the bottom. Alright, so probably the most common thing that you're going to see, well, that's not true. The most common thing I've seen in Silkens is not VPCs yet, which, yay, that's great. But the most common thing you don't want to see that you're going to see is a VPC. And basically, that's a ventricular premature complex. And that's an abnormal beat that originates in the ventricles. So if we remember, like, the little nerves that came down, the ventricles have their own beating ability, right? So if the SA node fails and the AV node fails, the ventricles need to be able to pick it back up and beat for the heart. But if they have a disease down there, those cells just get a mind of their own, and they try to take over. And so if your ventricle's beating really fast, and your atria is still working normally, then you've got two different heartbeats going on. Alright, so that's what it means early in the cycle. So before your atria can beat, your ventricle just shoots something off. 2 or more is going to be called a couplet, or 2, it should just say 2, not or more. 2 is a couplet or a pair, and 3 or more is a run. Isolated tend to not pose a significant risk of sudden death, but they can indicate an underlying disease. So the large breed guidelines say that less than 50 VPC in 24 hours is normal. 50 to 100, they say, is a gray area. In Dobermans greater than 300 VPC, they have dilated cardiomyopathy. The end. And I will tell you, on a 3 to 5 minute ECG in a Doberman, 1 VPC is 97% diagnostic for dilated cardiomyopathy. So, they are significant. Now, do I stress when I see 1? No. No. Do I start stressing when I see 20? Yeah, I actually do. Because I've done 100 Holters on my dogs, alright? And I know, I've kind of seen now where things start to go, so even though, my girl Cinder, she had 30 VPC when she was a puppy, and all the cardiologists said, it's fine. She just had 30 singles. It's fine. Don't worry about it. Next Holter, 2. Next Holter, 0. Next Holter, 0. Next Holter, 417.
Wow.
Yeah, so that's why I say when you see a bad result, you can't feel good if you have a good result the next time. All right, you got to just be like, why did I have this bad result? Is something there that I'm just not catching at the right time? Because now she's on an antiarrhythmic.
You saw no behavioral changes.
Nothing.
Jeez.
I mean, I saw no in her brother.
And she could have just stopped at any point with that going on.
Yeah, and her brother had nothing. I mean, he had 0, 3, 0, something like that, and then dead. Yeah. So, and Cinder had more because of that 30. Because I was like, I don't know that you say it's okay. You know, the cardiologist said it's okay, and I'm like, that just made me nervous.
What do you feel comfortable breeding a borzoi if they have a higher incident? I mean, you just don't know. That's heartbreaking.
All right, so a little bit more about VPCs. So this is Cinder's brother, Kiwi, and the top boxes are going to be pairs, so that's 2, and the bottom boxes are runs. And so actually, this one is 3, and then in this one he has a VPC and then a normal beat, and then 3 beats, and then a normal beat, and then a VPC. And dogs can have something called bigeminy, where every other beat is a VPC, or trigeminy, where every third beat is a VPC. I think those are a little bit more serious, so they will be read as singles, but if you scroll down through the listing where they list out all the beats, you need to look for it, all right? Because if they're having it every other beat, something's probably going on, right? Instead of just a random one here and there. Even if they only, like their sister had, I think, 7 singles, but her 7 singles were trigeminy, so she's having them in every other beat. So if I would have just looked at that handout, I would have said 7 singles, she's fine. She's a 7-year-old dog. But, you know, scrolling down, I'm like, oh, well, crap, they all came one right after the other. The speed at which they occur is relevant. So the little boxes in the background are speed, and depending on the cardiologist, the speed will vary, but it'll tell you like what the speed is, 25 or 50 or whatever. So the closer they come together, the faster that heart is beating, the higher the risk of the dog going into ventricular tachycardia, going into VFib. This one, so this VPC, and the shape is important too, and I don't expect y'all to know that. I'm just going to tell you because you may hear your cardiologist talk about it. So you can have multiform VPC, which kind of means that they're coming from different places, right? Like they're coming in a row, but the electrical signal is coming from different places, so they don't look the same. So it's kind of hard to tell that this one is a pair, but it is. It's 2. And this one's a little multiform too. This side is before he started an antiarrhythmic. This side is after. So this side he has RMT phenomenon, where we talked about, and RMT phenomenon also increases the risk of sudden death, they think, because it's starting so fast in the cycle. And so we have squiggly lines. Then after he started the antiarrhythmic, you can see that it's slowed down, and it's more spaced out. And that's basically what we try to do when we start the sotalol. It kind of slows down that heart rate to just then eliminate the risk of sudden death, but the thought is to decrease it. Alright. You don't want these to happen. This is just bad. This is bad. This bad. This is dead. So ventricular tachycardia, runs of VPCs occurring at a rate usually greater than 100 beats per minute. I would say greater than 160 beats per minute is where you want to start putting them on medication, where you want to get scared. This one's happening really fast. This is probably 300 beats a minute. Yeah. So this is that dog that now is on antiarrhythmic and diagnosed with dilated cardiomyopathy. This is VFib, and people only come back from VFib in the movies. Right? You have a defibrillator, you put the and I had someone, Saluki, drop dead at a course, and you know the club asked, would it have mattered if we had like a defibrillator there? No. If your dog has heart disease severe enough to drop dead, you're not going to get them back from it. All right. So you're not going to see this on your Holter,
Because your dog would be dead.
Because your
already.
dog's gonna be dead.
Yeah.
You halter back with that, you're not gonna have a living dog, right? If you get a halter back with this, you run to the cardiologist. You run. All right. Accelerated idioventricular rhythm. So this is kind of a gray area, right? So these are not fast enough to be considered a VPC, but not slow enough to be considered. They're just kind of in between what we're going to talk about next, an escape beat. So this is a rhythm above the normal discharge rate of the ventricle, so 40 beats per minute, but below that of ventricular tachycardia. So 60 to 100 beats per minute is when it's coming. This is Brexit's Holter. They all said he was normal. Went to 2 cardiologists, and then he dropped dead. So that's why I say it's a gray area, because in people they say ventricular escape beats, which we'll talk about, are really common in dogs. This they don't know what to do with. I would personally say from experience, if you have a dog with accelerated idioventricular rhythm, I would monitor them very closely. That's my personal experience. I don't like it, because obviously it can develop into something else.
Did you see anything before?
No, he was great. He ran 5 miles the day before.
Wow.
Alright, so these are ventricular escape beats, and lucky for Silkens, this is the most of what I've seen. And these are, for the most part, a normal physiologic thing. Okay, so I got 3 Silken halters that were not good. It's like, oh shit. And then, this has been the next most common thing. So, don't panic when you see them. Sometimes they will tell you, you had 200 pairs or something, and if you look down in the comments, they're just escape beats, okay? So, they look like a VPC. They're kind of this weird, bizarre complex, but they occur after a pause. So, you'll see that there's a long space between these beats, and what is happening is the dog is usually sleeping, and their heart rate is really slow, and their sinoatrial node is going at a slow rate because they're sleeping, and their AV node is going at a slow rate because they're sleeping, and their ventricles go, oh my god, we're about to die. Let's put off a beat to keep us from dying, right? That's what's happening. It's a natural rescue mechanism because the ventricles just take over because they think the heart rate is too slow. So they kick in at that 40 beats per minute rate.
We're being drowned.
Oh. In the absence of really, really long pauses and other conduction system diseases, it's a normal finding. Everything okay?
They heard the drone, I think.
Yeah. In this dog right here, this dog is having a V block, which we'll talk about next. So it has a P wave and no QRST complex following it. And then it's the second degree AV block, and then it has first degree AV block because it has a pause between a complex, and then it has an escape beat too, because it's like, all right, why is my heart not beating? But dogs have really high vagal tone, which means their vagal nerve is super sensitive, and so dogs with high vagal tone tend to have these escape beats, and right now I wouldn't worry about it. Okay.
But you haven't, in the Silken halters you've seen so far, you've not seen the same percentage in Borzoi that you've seen problems.
Silkens have way more escape beats than Borzoi have ever had. Yeah.
But the concerning stuff, you haven't seen as much of it.
No.
That's good.
It's good. I will say that a lot of Silkens have been younger, though. So, definitely need to get some older dogs done.
And we really, very rarely, there's been 3 dogs that have dropped dead.
Yeah, and that's good. That's great.
Years that I've been in the breed.
That's great.
I just did a 5.5-year-old and send the results to you.
Perfect.
Do you want to spray?
No, it's okay.
Yeah, you should
actually-
do drift.
Because I think that's...
All right, so supraventricular beats, supraventricular tachycardia. So we're just talking about something that's happening above the ventricles. Usually in the atrium is where those abnormal beats are originating from. When they're coming from the atria, there's usually from some heart enlargement. So this way you can see them with other diseases, not dilated cardiomyopathy, but you can get atrial enlargement with dilated cardiomyopathy in some breeds. For rare SVE, there's no treatment, but frequent, when they look like this, it may be a sign of impending AFib, which definitely does need treatment. So we tend to see it, we do see it in Borzoi, for sure. What's kind of interesting is, like, I don't think any of my personal dogs have had significant SVE, but they've had relatives kind of closely related to the line with a lot of SVE. So I think it can be kind of the complex of what's going on in them, but they don't show up as commonly as the ventricular beats. And I don't think that I've seen any SVE in Silken so far. So the one thing, if you get something like this, and they say it's supraventricular tachycardia, but it could be sinus tachycardia, I would have a cardiologist look at it just to see, because dogs' hearts, when they are exercising, can go super, super fast, like, 250 beats per minute, and it's totally normal, and it can be hard to differentiate from the abnormal stuff, right? So just to make sure, if they say it on the Holter reading, you may want to have a cardiologist read it. Hopefully, probably it's going to be sinus tachycardia, but just to make sure. All right. AFib. Pretty common in people. Anyone here have it? It's basically where there's no P waves, and I just say things are just kind of like oscillating along. And this dog actually has a VPC in the middle of the AFib. So this is the OFA form. He's an AFib, so this is his Holter. So he didn't really have many ventricular arrhythmias, but he did have AFib, and so with AFib you can't see if they're having SVE or anything else because things are just squiggling along. It can be caused by structural heart disease. It can be caused by cancer on the heart, because remember, it's on the atrium that cancer is. It can be caused by congenital heart disease, or large breed dogs get something called lone atrial fibrillation, and we don't really know what causes it, but it does run in certain lines. So definitely, with any of these, you want to get an echo done to see what's going on. AV block I have seen in Silkens. It's really common in Borzoi Holters, really, really common. So basically it means there's an interruption of the electrical signals that stimulate the heart to contract. So usually, the SA node doesn't do anything, then it goes down to the AV node, and for whatever reason that signal gets interrupted. And again, this can be from vagal tone, right? So it can be really normal in dogs. And type 1, first degree, we don't care about it. There's just a little pause here between the P wave and the complex. Second degree type 1, see a ton of it in Borzoi, usually vagal tone, who cares? Second degree in type 2 and type 3, you don't want it. You don't want a bunch of P waves without QRX complexes going along, right? Because you're not having a real heartbeat. So if you see that if they put in the comments that they have type 3, then that would warrant a cardiology consult. Oh, and for AV block, treatment of choice is a pacemaker. Tell your heart to beat, pacemaker.
Do they do that for dogs?
They can. Yeah.
Do they do that?
Yeah,
They can. Not that they do. They can.
Very expensive,
prohibitively
but they can. Yeah. So, bad result. What do? This is little Nora's Holter with the dilated cardiomyopathy. This is the worst Borzoi Holter I've ever seen. And she's 8 months old. So, yeah, she had 83,000 20,000 total, 9,600 singles, 20,000 pairs, 10,000 runs. And
How is she alive?
Yeah, I don't know. And they come in super fast. Highest is 266 beats per minute.
Wow.
Yeah. So, you get a halter, it has more than 50 VPC, SV, any pairs, runs, etc., AFib, or like really frequent AV block or type 3 AV block. Go get an echocardiogram. Do another halter in 6 months. Unless, your cardiologist starts your dog on medication, which they may, and then you usually do a follow-up halter in 2 to 4 weeks. Greater than VPC or multiple complexities warrant, I would go, start looking, really, really fast, right? If you have a dog that's having ventricular tachycardia, I'm going to tell you to run. Get on it. I don't want your dog to die. And like I said earlier, remember that arrhythmias fluctuate. A really bad result one day may be normal the next. Have a bad result, believe it, and investigate it. And so you have a bad result and you're like, how do I even go on? What do I do? Whether it's an echo result or a halter result, I know that a lot of people feel really down about it, right? Or an eye result. You're like, well, what do I do? And so I'm just going to tell you what I do. I test all first-degree relatives every 6 to 12 months. So if they have a normal halter, 0 to 3 VPC or whatever, I'll wait a year. If they have anything concerning, then I will retest at a maximum of 6 months. Do not remove entire lines from the gene pool because of a single dog in your line with a bad result. It's really stupid because you're just going to pick up something else. Because if you remove all these genetics in a rare breed, you're going to bottleneck it. And just like with CEA, just like with MDR1, the likelihood of every dog in a litter being affected is low. The likelihood of every relative being affected is low. So you take out the effective dog and you breed smart with relatives. And you have communication with people. You have communication with people and you be honest with each other so that you don't create a problem. This is my dogs. I took away the top that don't belong to me and the bottom that don't belong to me, but these are the ones that belong to me, and kind of how their halters have played out. And so you can see that things go down from generation, and this is how I organize it, right? I just follow it down. I'm gonna retest. I'm not gonna pull every dog from the gene pool, but I'm gonna test and test and test and breed smart, and just know that there is no perfection. Okay? You're gonna make a mistake. You're gonna breed the wrong dog. It's gonna pop back up. It's okay. You can't play God here, right? Things happen that are out of your control, and you just do the best you can, and you be as honest and as open as you can. Alright, so, in summary, there are multiple congenital and acquired structural and electrical cardiac diseases that affect dogs. We don't know the prevalence of different types in Silken Windhounds because they're a relatively new breed, right? And we don't have all that data mapped out yet, and especially with halters, they just pretty much started. Routine multimodal testing of breeding dogs and relatives will not only benefit the individual dog and your breeding decisions, but it's a positive way to contribute to the overall health of the breed. We don't know specifically what defines a normal halter in Silken Windhounds, so this is for data gathering. At the end of, in 5 years and 10 years, say, Silkens don't have any, they're fine, great. And then, if you keep doing it, if something pops up, you can identify when it came. So this is to get ahead of the game, right? You want to catch a problem before it starts, and be able to identify if it starts in your line, where you brought it in. And do not pull dogs out of the gene pool for a single gray area result. Don't do it, just retest them, have a cardiology consult. Like I said, there are other diseases that are not hereditary that can cause abnormalities of the heart. So Don't just say, my dog had an abnormal halter, I'm throwing him out. Go get it worked up, see what's going on, follow up with a second test, and then go from there. And go with the advice of your cardiologist. They're the expert. Something really important is that we are in this together. We are a community. We are doing this not just for you, but for everybody else. If someone has a bad result, your time will come, right? Be kind to each other. I mean, openness and sharing is the only way we can prevent these things from becoming a problem. And just know that you're not alone. Like, everybody produces a sick dog at some point, and we don't do it on purpose.
For those of you who don't know, Danielle has kindly agreed to run our halter program with Ashley to gather data on our dogs and working with Texas A&M to analyze results. So
Thank you very much.
You're welcome.
it's huge.
Yeah.
All right.
We want to know if we have a problem.
Yes. So these are my babies. That's what I'm here for. And do you guys have any questions before we do the halter demonstration?
So, I've been running and organizing the health clinics for the breed since 2007, and for the most part, we've only done auscultation. So even the echoes are new in just the last probably 3-4 years.
Yeah.
And we couldn't get anybody for this one.
Yeah, we tried. We tried to get
Yeah.
someone here today.
It's
but
tough.
Yeah, it is. They're so busy.
Yeah.
They're so busy. I don't have a specific question. I just want to say that the echoes are even new.
Yeah.
For our
Yeah, and that's kind of what I
It
figured.
seems like the echoes are brutal for the person who does the clinic because it's like all day long, one dog after another. Like it's.
Yeah,
Yeah.
at SilkenFest in St. Louis, we had 60 dogs, and 53 of them were echoes.
But we mostly were fine. Like there was only
There were, I think, 3 abnormal in our breed.
not-
There were other
not
breeds
like
that showed up.
that.
No,
Yeah.
I don't remember what
Yeah.
specific.
Well, nobody burst into tears.
There were some tears.
Oh,
There was some crying. I recall hearing about it.
Oh, now I remember.
Does anybody have the halter?
Yes.
Okay. We'll put it on Olive since she's already.
She's already naked. Where she should be.
She's a broad story.
Is there just one? The halter?
No, there's several.
Yeah.
Does anyone have the halter?
So Ashley's in charge of mailing them out and maintaining the equipment. We have several halters to do that with. I haven't done my dogs yet because I live 10 minutes from Ashley. I'll get to it at some point. But so then she gets the data, then she works with Texas A&M. It's the sequence. We paid a lot of money for all this equipment. The club did.
So how would you recommend scheduling? Would you do like an echo 1 year, halter next year, echo
I think that's reasonable. I mean, I think that the halters are a little bit more accessible. So, you maybe could do a halter every year and then do an echo every other year.
Certainly, it's cheaper.
Much cheaper. Yeah.
ideally,
are-
what would
are
be the gold
so
standard
expensive.
for testing?
If I had it my way, every year.
The ball?
Yeah,
But
they
yeah,
cost,
I
they're
think
really
reasonable every 2 years is reasonable.
Okay.
And don't stop once you bred your dog, please. Like, it's not a one and done thing. Like, your dog can have something later in life.
That's the one that's arm hat.
You can put it on blend. Here, I'm gonna just sit.
Oh, the screen's behind you, so don't.
I'm not gonna be back.
Hi, Olive.
Put it on. Forget it. Sit
So yeah, at some point this year.
Yeah. There's someone here.
I think Randy said she'd be taking it.
Oh, perfect.
Oh, so you want to try this vest on hers? This is smaller.
It's really
No,
tiny.
this is the medium small.
Yeah, we have a list.
Yeah.
Okay.
Yeah, there's some in there.
So,
So you just did her.
Yep. It was her recheck after being on Subtle.
okay. So you should come with at least 5 of these. There's only 2 in there, so I can't put them
But
all.
yeah, Michelle just used it.
I can't
I
put them all
just
on.
returned it today.
But basically, you can't. You're gonna shave your dog here. I know it's awful. But I shave like a vet. All right, so I shave half the dog off. I want my electrodes to stick. There are people that shave like they care, and what you can do is you can, instead of going this way, you can flip the hair up, and you can go this way.
Diggy's got it under here. Underneath.
See, Randy cares.
Can't really see it. But
You can't even see it. Yeah, on a young bald dog, you're going to be able to see it, but if they have any coat, you're not going to be able to see it.
I'll have Storm with me tomorrow, and you can see how Ashley shaved him sideways, and you can't even see it because his hair comes down.
Oh, I have Leo over there. I can bring him.
So I'm not going to unstick it, but
I did
basically,
horizontal on him like 2 weeks ago, and he's fine.
you're going to stick them on here like, it really doesn't matter. Whatever way you want to put the cords. I like to put it this way. So stick them on here like this. They have a sticky back. I like to clean it with alcohol first, let it completely dry to get all the oils off the skin. I have one dog that is so oily, I don't know what's wrong with him, but those electrodes just like fly off of him. It drives me crazy, so with the Borzoi halter, I actually send out medical tape, and once I have this on and the electrodes attached, I wrap them with medical tape so it doesn't come off. I don't like redoing them. So you're going to put 2 on this side, and you're going to put 3 on this side. And on this side, it's going to be black and brown. And then on this side, it's red, white, and green. And there are instructions in the box. So once you get the electrodes stuck, you'll have the halter. This plugs. I don't take this apart. I just leave it like this and wrap it up. You don't have to take this off.
I've never taken mine off.
Yeah, I don't do it. So basically, this has a little sticky. This goes here. It pops in. All right. I will say this. Before you stick this on the dog, I always forget to do this. This vest has a hole in it. So you are going to want to
Thread it through first.
thread it through first.
Guess how many halters I've done? Like 12 now or something? Guess how many times I've threaded through the holes?
Yeah.
1 time.
Yeah, so before you click
It was the last time. Yeah.
Before you click the one, don't be a dummy. I do it every time too, and thread it through the vest. And then I just kind of like have them, stand here like this. So then you'll click them on. You'll put the vest on. You're being cool, baby.
He's gone away.
Torture. That's never gonna fit around her.
We're just gonna pretend, okay? There we go. All right.
Oh, poor Olive.
All right.
I'd like to leave. You don't have to do that. There you go.
So. Alright. So this is a little carrier, yeah, and it just like literally sticks on the vest, and this is where you're going to put it when it's done. So it's all hooked up, all the electrodes are on, right? You pull this off here, and the little SD card just pops in and out. Alright, so sometimes they'll be in the bag, sometimes they'll already be in here. I'm going to tell you something about this SD card that the Borzoi people are going to kill me. Do not erase this file. Do not change the name on this file. All you get to do is drag this file into the box. It says Flash Data on it, on the website. Don't erase it. You're going to erase it. The next person is going to erase it. I'll show you when the halter comes in. Nobody's going to get your data. Only Alba Medical can read it. They have a special program to read the file on here.
So you've gotten it erased a whole bunch of times.
Oh my gosh. They change it to their dogs' names.
Oh no.
They erase it.
So don't label it, just do the thing and
Just drag it, alright?
Renaming it screws up the whole result system.
Yeah, renaming it, they can't read it. You have to buy a new one of these cards. Just drag it. Because,
so you check it every time.
Yeah.
Because when you put it in here, I'm going to show you. I can put the battery in. So
that's your on-off switch.
Yep, this is an on-off switch. So that's all you have to do is put the battery in. And you'll see it thinking once you get the battery in, okay? And it's going to ask you, erase memory. This is the first thing. And that's when you get to erase it, all right? You're erasing the dog's data before that. All right, so arrows up, down, hit enter. Yes, you can erase it, okay? Then you're going to start, it's going to ask you, to go forward, enter to continue. I'm going to go to new patient, enter, put a patient ID. I literally put one for every dog. I guess if you're doing multiple dogs in a row, then do 1, 2, 3, 4. Some people put their dog's name. Some people have special codes. I don't care. I know what dog I'm submitting. So you can do whatever you want. It doesn't really matter, right? We'll put 2. Enter. Enter. Oh, event done. Alright. So then you're going to hit event, and it's going to tell you your connection. She has no connection. Right. So it's 0. But it'll show you the 3 different leads, right? And it'll show you the signal strength. So 5 is the best, 0 is nothing. I usually like on 4 to 5 on all 3 leads. A lead can pop off, but they need at least 1 happening, and the more the better while it's on there. So if 1 electrode pops off, don't go into a panic. There are actually 3 channels reading, okay? And then to start your halter, you're going to hit event. A time is going to show up. Remember that time. You're going to take it off exactly 24 hours later.
And if there's daylight savings time, calculate that.
Yeah, so it does not stop on its own. You stop it. It's not gonna, a timer's not gonna run down. One person left it on for 48 hours and they were like, it never stopped. And I was like, oh my God, you stop it.
And you take the battery out.
That's nobody's dog, right? It's a dog.
There's someone else there.
Oh, okay.
Yeah, no, people run their dogs off.
Okay.
We got
You see a
about,
dog run across the field.
we got around a half an hour away.
Okay, so to stop it when it's 24 hours later, you literally just take the battery out. You take the SD card. If you don't have an SD card reader on your computer, there is a adapter with a USB in here that you can use. Follow the instructions to go to the website that are in the box. You'll go to Alba Medical. There's a tab that says Submit Halter. If you have a pop-up blocker, there's a pop-up that comes when you click on the thing to submit halter. It tells you exactly what information to put in for your dog. You put your dog's name, age, birthday, sex. If anything crazy happened during the halter.
Like your dog jumped into a freaking creek.
Like that, yeah. And then you hit submit. If you have never used it before, they will send you an invoice for $40. Check your spam folder. It likes to go there. And then after you pay your invoice, it comes very quickly. Usually, if you have submitted with them before and you have your credit card information saved on Squarespace, if you submit it at 8 p.m. at night, you will get your halter back at 8 a.m. the next morning, unless it's the weekend. So they're very fast. But I'd say within 24 hours is the turnaround time.
That's fantastic.
Yeah.
Next business day
Yeah.
in the
Really
mornings.
And then this little thing right here, I just wrap it when it's on the dog. You just wrap it all the way down as an extra thing of support. On my dogs, I put a t-shirt over it so that they can't scratch it off. One of my boys likes to go in the bushes, and this thing, he's come inside and there was nothing, and this whole apparatus was in the bush. Oh. So just an extra line of defense, or if you want to use a coursing muzzle, just to be extra safe, you can do that too.
And we have the sign up for the halter program online now, right?
No.
No?
We had to remove all of those forms, and they're being redone.
Yeah, okay.
Yes.
So we're working on getting it online again, and
It'll hopefully be soon. I'm almost done, but I had to reword and reformat a bunch of things.
Yeah.
Do we know if I can help at all?
Yeah.
Sure.
On online stuff.
Yeah.
Well,
If you guys wanna, would you guys be able to create like just the forms on the website, that would be great. Yeah, and
That's
then
why I say, let me know.
yeah, and then they could just forward to my email. Yeah, that'd be amazing.
So
Yeah, because they can go no better.
Somebody may give you a
Okay,
ride.
yeah, I'll be in touch with that.
Yeah. You just give me the
My mom
information
is
you need,
up
and then where it needs to go.
Carmen
Then
tomorrow
we can
at
just do that.
7:30.
Yeah,
There's like stuff you need
yeah.
that
We could do
Side or something.
Yeah.
They can